Hello, this week we're going to do something special that we try to do from time to time, and that's just answering your questions. In case you haven't met us before, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN.
And we are the Doctors Bjorkman.
Welcome back. So here we go. Every once in a while on our community page, we will leave a Q&A where you all can leave questions, things you'd love us to talk about, and then we try to answer some of those in an episode. So that's what we are doing this week.
Yeah, so make sure you're subscribed too so that you catch those when we post these opportunities to answer your questions.
Yes. And the first thing we'll talk about briefly, everyone wants to know about potty training. Potty training advice. Caitlin Abercrombie 491 said, potty training before 2. My 20-month-old can tell us what she's done, when she needs to be changed, and used to give a tiny bit of warning, but the novelty of the potty is worn off, and now she'll wait until she's done so she doesn't have to stop what she's doing.
Yeah, I imagine we got a bunch of questions about this because in an episode 2 weeks ago we shared, like, we have 2 young children, yes, both of which we potty trained before 2.
We did, yes. So this is more than a 3-minute answer. And so we are going to do a whole episode on potty training next week. So stay tuned, whole episode coming. I think brief thoughts are totally possible. Very child dependent.
Yeah.
As much or more of it is about you being ready to commit to the process. Yeah. We use the OCRAP potty training book for CEASE.
And then a lot of those same methods we just just did for Bo.
Yes.
And so, like Sarah said, like, you have to be ready. You kind of have to have the environment and situation to be ready for it. But you know, sometimes it can be even well before that too. And we'll talk a lot about when's the right time, things to think about, and things you can do to improve your chances of success.
Yes. Stay tuned.
Okay, good. Let's see, next question. This one comes from Miss Pink Sparklefly. Mentions, good morning TDB. I'm currently 30 weeks pregnant with my second baby. Congratulations. We are very excited. However, a few weeks ago, he was diagnosed with tetralogy of Fallot with pulmonary stenosis. I'm wondering if you guys could shed some light on the best and worst case scenarios of this diagnosis, as well as what breastfeeding a little one with this diagnosis. Thank you. Tetralogy of Fallot is actually the most common cyanotic congenital heart disease. We say congenital heart disease occurs in 1 in 100 pregnancies, and of those, about 5 to 7 of 100 are tetralogy of Fallot. It's a special constellation of 4 things that includes this pulmonary stenosis, or kind of tightness of the outflow tract of blood getting from the heart out to the lungs. Most of these children end up needing a surgery sometime during the first year of life. Sometimes in severe cases, they need a surgery or a procedure of one way or the other in the first month of life. If they need an early procedure, that usually means they might potentially need a second procedure in infancy. And then maybe they need other repeat procedures long term. It really depends on the severity of how tight that outflow tract is out to the lungs, and what kind of procedure they need as an infant. I will say kind of best case scenarios. I think it's great to know. You may remember Shaun White, the famous Olympic snowboarder, was actually a tetralogy of Fallot patient, actually in multiple co-residents in pediatrics residency who had tetralogy of Fallot as infants. So, you know, there's really, with advancements in modern medicine, amazing surgical techniques, and great care for congenital heart disease, in many cases, most of these patients do very well. Definitely a lot of them need multiple procedures through their life, and it depends on kind of the degree of severity of that disease. So talk to your pediatric cardiology team, ask them specifically. And I will say you ask about breastfeeding.
And I think one thing to think about with this, for the rest of your pregnancy, you're going to be followed more closely. There's going to be coordination with the pediatrics team, with your OB. They will want to think more carefully about your delivery timing so that they have all of the support staff available when this little baby is going to be born. And so it will probably change how the rest of your pregnancy looks too, in terms of monitoring, more fetal echoes, and your delivery timing. So hang in there and kind of, I would say, prepare for that a little bit too.
Yep. Yeah, and they'll talk about oftentimes these infants do very well with normal vaginal birth, etc., and can do normal things like breastfeeding. Again, a lot of it's going to depend on just how severe of a flavor of tetralogy of flow your little boy has. So good luck.
Yeah.
We'll be here rooting for you.
Yes. All right. Next question. New mom, only about 6 weeks along, but I've been reading what to expect when you're expecting, and it mentioned RH compatibility. When do they test for that, and when will my husband need to go with me to the appointment to have his blood drawn? So, RH incompatibility.
This is like are you positive or negative on your blood type? Is that
Correct.
okay?
So, when we think about blood types, there you have a letter A, B, O. Okay, these are antigens on red blood cells. And then there's also a positive or negative. A positive, B negative. This is the RH factor. So RH incompatibility kind of talks about when mom is RH negative. If dad is RH positive, there is a chance that baby could carry that positive antigen, and then mom's body kind of attacks that, recognizes that as not self, and can cause issues, usually in a subsequent pregnancy. Yes. However, we can screen for this. And so for your first trimester labs, your OBGYN is going to check mom's blood type. If mom is any variety of positive, A positive, AB positive, O positive, it means this is not something we have to worry about. It's only something you have to worry about if mom is some negative, RH negative.
And then dad is positive.
And then dad is positive. So option one is dad can be tested. That isn't something we often always do. Most of the time, if mom is RH negative, we just give mom RhoGAM during pregnancy. This occurs around 28 weeks and then postpartum, depending on baby's blood type. Or if you have any bleeding throughout the pregnancy, you will get RhoGAM.
And RhoGAM, is that a pill? Is that a shot? What is that?
It is an injection that kind of simply, if there's any extra, what's the best way to explain this? When there are fetal cells in mom's circulation, if they are positive and mom is not, it kind of soaks up those fetal cells so that mom's body doesn't recognize it. And so it's checked first trimester to check your blood type. And then you go from there.
Great.
Yeah.
Okay. Let's see. Next question. So this one comes from Amanda M. 5605. And they say, what are normal heart rates for babies and kids when sick with a fever, and how long is it okay for them to stay at a higher heart rate? So this is a great question. We actually have done a video all about what to do when your baby has a fever, so check that out here. We'll say the first thing is to know what are normal heart rate ranges. So to know what your max heart rate is really helpful to know that on average, each of us, our heart rates could get up to, we'll say, if you take the number 220 and you subtract your years of age from that, so if you're 20 years old, 220 minus 20 years would be a max heart rate of 200. So if you have an infant, their heart rate could easily, with a normal heart rate under stress, get up to 220 beats a minute.
This works for children?
Yeah, works for children.
I did not know this.
So and even for some infants, it could be normal when angry or stressed to have a heart rate in the 220s. Okay, works. But they shouldn't be sustained to that. And the question is what makes your heart rate go faster? It could be anything from dehydration, fear, pain, anxiety, etc. And so if your baby is sick and they have a fever, the heart rate is going to go up as a response to that fever. They also may be a little dehydrated. The heart rate is going to go up as a response to that. The biggest thing is that your baby is drinking well, peeing well, staying hydrated, not having too much increased work of breathing or trouble breathing. Of course, if you're concerned about any of these things, talk to your pediatrician. Ideally, the heart rate isn't staying in the high 100s or above 200 for very long. If the heart rate is above 200 for kind of hours at a time, like sometimes that can cause issues. If it's there for hours or up to a day, it can start to cause some issues just with the heart muscle itself. But generally, in the setting of a fever and illness, even these higher heart rates for hours can be very well tolerated. But if you're concerned, talk to your pediatrician.
Awesome. All right. Next question is from Sarah Burton, 9624, and she said, advice for a first-time mama whose due date is in 3 weeks.
Oh, congrats.
Yes, so exciting. Specifically, advice for keeping calm during labor, keeping body relaxed, not panicking. First of all, congratulations. So excited. You are almost there. Things that helped me and just for life in general is feeling prepared. And for me, that is doing lots of reading, taking a birth class. I remember at the end of my first pregnancy, I took a class by the Vagina Whisperer. I'll have to...
I didn't take the class.
Yeah, it's Kim Vopney's course, and it's called Birth. I have to look it up.
We'll link it in
Yes,
the show notes.
I'll put it in the notes. But basically, she went through different pushing positions, pushing things you could do with your partner, some kind of birth prep that you could take. And it was just really helpful to be reminded of some of those things, even though I knew them, and just refresh that. Would watch different YouTube videos.
Yeah, we've got videos actually from both the births of both of our children that you can check. Having your hospital bag packed. I think like what I'm hearing you say is just being prepared and knowing some things to expect.
Yes.
I will say, like, there's definitely like patients that come in with their birth plans, like,
Yes.
here's exactly how we want things to go scripted, and
Sure.
realizing that, like,
Yes.
things can't be scripted, but like having an idea of what to expect and then
Yes.
being willing to be flexible. Is that fair?
This is exactly it. Knowing what to expect helps me all the time.
Sure.
Whether it's how far am I going to run today? What's the route? What should I expect at the hospital? What should I expect for birth? And some of that as an OB, knowing expect the unexpected a little bit, but just...
Baby's gonna make their own plans.
Yes. But anyway, those are some tips. I will link that class I did. And yeah, you're going to do amazing.
Yeah.
Remember, you can do this.
Yeah.
Women have been doing this for thousands of years. We want you to do that in a safe, empowered place. And so check out some of our videos to help get you ready.
Okay, awesome. Let's see, next for us. This one comes from Karen
LR8KI.
That means something.
Probably.
That's something.
Don't try.
Okay, not gonna try. Anyway, thank you, Karen. And they say, what parenting things do you do differently with number 2? Gosh, I think one thing for number 1, like your 2-on-1 and your ability to like be like so focused on like little milestones or like having a strict schedule, like just like really goes out the window when there's a toddler running around also.
Yeah.
And so like Cecilia, our first, like she like ate at the exact same times every day. Like she like we did bath at 6:30. Like she was in her jammies with a book at 7 and was asleep in her crib at 7:08. Like was like infancy for her.
Yeah.
And then with Bo, like because Cecilia was then almost 2 years old running around, like his schedule is some variety of a theme that
Poor
is
kid.
not really that.
I think we also respond slightly less quickly to like unhappiness, like discontent feelings.
Yeah.
Sometimes just like things where with the first one you're like, oh, she's crying, she's upset, like immediately what is going on.
She wiggled her left toe.
Right,
Skinner,
because you're just there entertaining them, doing all the things. We don't do as much with the second. We're like, oh, this is fine. He's fine. Let him sort it out for a second.
Yeah.
They're also totally different kids.
Yes.
So everything we thought we had figured out for the first one didn't work for the second.
Yeah. Like, and we felt like we had a rough time with baby number 1. Just like a very spirited first child. And like like she's still way more spirited than her brother is, but like you're like, oh, like we're experts at this parenting thing.
Yeah,
and then the second kid comes and they just like the things that the first one struggled with, they don't, and they struggle with different things. And so like you learn to be flexible, like, you know, some degree of benign neglect. Actually, like, we're going to talk about this. Actually, we've got an episode coming up in a couple weeks talking about toddler tantrums too. And like how do different parenting styles and ways that you can maybe help your children build some autonomy, independence, and resilience.
Yes,
okay.
yes.
Good luck with number 2.
Yes.
It's a trip. It's wonderful, but it's super hard.
Yes. Next question comes from Sleepy Feline 2017, and they asked, can we talk about baby wearing? I know many people do front facing with the carrier once baby turns 6 months old, but I've also heard that's too early and it's not good for hip development. Thanks so much. Love this question. Love baby wearing. Wearing the children around has saved us on
so much.
Many occasions. So the overarching guideline here is to wait until baby can sit really well supported, unsupported. Make sure they can sit on their own, unsupported. And for most kiddos, that's around 6 months old.
That's for front facing.
For front facing. Okay. Yes. And so they say, hey, wait till baby can sit, and then try to limit that time in the front carrier because it's not really a great position for kiddos to be in. Mind you, like, they love it. A lot of kids are just so busy. They want to be looking around. They want to see what's going on in the world. And so the body positioning in the front carrying really doesn't support the head, hips, spine as well as it does when they kind of have that C shape against your chest. And so again, you try to limit that to shorter amounts of time and then make sure they're in really still good positioning. And we'll show a little picture here of like hips kind of, M shade with hips rolled forward, not kind of like dangling down.
And knees above the hips. I remember that being a thing, right?
Correct. Okay. And babies should never, ever sleep when facing forward because they just can't really support that airway. Yeah. So when baby starts to get tired, overstimulated, just flip them back around to you.
Yeah, and it just like makes it so easy to like take your kid and go. Like I remember just all the fun I had, like just like throwing a kid in the carrier, like, hey, we're gonna go get groceries, we're gonna go for a walk. Like it just makes it that much easier when there's two running around to have one that like, okay, like this one's stuck to me. Like I only have to worry about the other one running.
Bo lived in a wrap for a good chunk of his baby life.
Did we did a video about
We did about how to use a soft wrap for sure that we can link.
And then like, you know, thinking about good wraps, like whether you use woven wraps or like we used the baby Bjorn, was that what I wore a lot?
You love the baby Bjorn.
That was easy for me as dad to like, I don't have to worry about which pass to make. I just like throw them in and pull things snug and go.
Yeah.
Okay. Awesome. Let's see, what's next?
Ooh.
Okay. This one comes from at the SMH 1100. How to pick a pediatrician. This is another topic we've actually done a whole episode about. You know, like thinking about what are your goals for like your children, kind of some specific health goals. How do you find someone who is ideally certified, board certified, has all the appropriate training to give your child the specialty care that they need. I would say being a general pediatrician is really hard. There's so many things to think about in a sea of like overall wellness. And then the other thing is you really just want to find a pediatrician who's willing to talk through like, hey, like what is the purpose of this vaccine? Or why do I need to see you every 2 months for the first couple of months of life? What are the things you're looking for? Because at the end of the day, you want to trust that their advice is like what it is, and you want them to be able to hear your needs really so that it can be a mutual respecting relationship.
Yeah, fit matters. So ask your friends, ask people you work with, who do you take your kids to, who do you like around here, because obviously location, you only have so many choices in a reasonable distance. Like if your kid gets sick, you want to be able to take them to the pediatrician. What do your friends think? Who do they like? And you can go meet your pediatrician, like meet some different people ahead of time just to see, hey, is this a good fit? And I think that's really important because you want to have this long-term relationship. They're going to know you and your family over a long time. And I think even now with Cease, I've thought about like, oh, this pediatrician, we haven't thought tons about it because, you know, Kurt's a pediatrician. So a lot of things, anticipatory guidance, things like that, some of that I get here. But I thought about the relationship for her and this doctor. When she's 13, is she going to feel comfortable talking to her pediatrician? How are they going to have this talk about sex, drugs, and rock and roll and needing birth control? And like, how is that going to go? So I also started thinking about this relationship that I want my kids to be able to develop with them as well, as something that I didn't necessarily factor in when we, you know, chose now, because they're 1.5 and 3.5. So that was something recently I've been
I hadn't thought about that, but that's a great thing to think about. So check out that episode we've done, and let us know if you still have more questions after that.
Yes.
Okay,
the next question. They asked, I had preeclampsia during my first pregnancy and I'm 9 weeks pregnant with my second baby now. I know chances to have it again is pretty high for me. Is there anything I can do to decrease the chances of preeclampsia with this second pregnancy? And the short answer is yes. So research studies kind of say, hey, the chances of having preeclampsia again in a subsequent pregnancy is around 15 to 20%. However, it depends on your risk factors and what those are. It can be a recurrent risk of 5% or 80%. So there are some different things there. So things that you can do. Number one, and again, this is talk to your provider about this. This is so important, but the USPSTF followed by SMFM and ACOG have recommended women who have one or more risk factors for preeclampsia start taking baby aspirin around the 12th week of pregnancy. And so there is a long list of risk factors. A history of preeclampsia is one of them. Having twins or more than one baby, having chronic hypertension, having type 1 or 2 diabetes, kidney disease, other autoimmune diseases. Combinations of some of these risk factors, like being over 35, it being a first pregnancy, IVF pregnancies. So there are many indications where baby aspirin could be helpful to help prevent preeclampsia. Otherwise, things we know that are helpful are to try to manage chronic conditions pre-pregnancy, post-pregnancy. And so just trying to be as healthy and well as possible also can really help. So talk to your doctor about starting baby aspirin. They may say, hey, yes, you have these risk factors. Let's get you going on that.
Okay. Awesome.
Yeah.
Little plug for just like being active and well.
Yes.
Good nutrition, active lifestyle, etc.
Correct.
Really helps with a whole lot of things.
Next question, is pumping and bottle feeding as good as breastfeeding? Absolutely. It's the same milk. It's either like direct from the spigot or you've pumped it and give it to them in a bottle.
And that's in that benefits to mom are the same for breastfeeding duration, and the nutrition for baby are the same.
Correct. There's some studies on like, hey, latching to the breast is good for oral development and some different things like that. But your baby is getting the same nutrients. You are burning calories pumping. Pumping is a labor of love, but it's absolutely great for your babe.
So I think that's all our questions for the week.
I mean, there were so many great questions. We didn't want this episode to be an hour long, so we promise we will do more of these throughout the year, and we are just excited to be back, and thank you for being here and asking wonderful questions.
Make sure you're subscribed so the next time we post a Q&A, we can hopefully get to one of your questions, and we'll be here next week. Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.